Scientists are hard at work learning everything there is to know about the coronavirus. COVID-19 is just over 7 months old, and globally the virus has taken center stage in reorganizing work, socializing and staying healthy. There's now new information about the impact and treatment of the model virus strain. Health E-News put together some of the latest studies on the global pandemic. And joining us now is Health E-News journalist Nelisiwe Msomi. Ms. Msomi, thank you very much for your time with us here on Flattening the Curve. How are we in terms of understanding exactly what COVID-19 does to the body? Initially, it was thought to only affect the respiratory system, and now it's moved on to an understanding that it affects anything and everything from blood circulation to our cardiology.
I mean, it even affects the semen of men. Okay, I think COVID-19 has taken over what we know as normal in our lives and normal in science, and I think like a lot of like Prof. Kareem and other scientists say, we're still in the very early stages of the virus. We're still learning it. So a lot more studies are being done to find out like how does it impact certain parts of the body and how does it react to certain treatments that are existing and possibly new treatments that could come because of it.
I suppose the easiest way to illustrate the changing approach of medical professionals to the treatment of COVID-19 has been around the use of ventilators. Once thought as critical in the fight against COVID-19, some studies are now showing that it can actually be more detrimental to patients suffering from the disease than beneficial.
But what we are also seeing that we have existing drugs that can actually help patients who are using ventilation systems. You know, patients who have severe COVID-19, can use drugs. Like one study found that drugs that are used for lowering cholesterol can help with that. So I think right now we're on the path where scientists are looking at existing drugs that are easily accessible and drugs that are cheap. Especially in developing countries like ours, where there's high rates of COVID-19 and as you are talking to Prof. Kareem, that we are at a place where we are peaking. So such research is needed. And like you said in your own conversation, Prof. Kareem, that a vaccine is still a long way to go. So we need to find interventions that are quick and also can help us flatten the curve.
Have we learned how comorbidities like diabetes, tuberculosis and the like has affected people suffering from COVID-19? Are we better understanding how these comorbidities have, in some instances, resulted in a virtual death sentence for people that have contracted the coronavirus?
The study I was reading was talking about how there'll be a high death rate of TB, and South Africa being one of the main countries. And, we have a high burden of TB cases as a country. And what COVID-19 has also done is that it's put every other health matter on the back burner. And we've put all our resources and energy and focus onto this virus that because of that, we have HIV and TB not being looked after. Last week I was speaking to the NEC of Health in Gauteng, and he said, they didn't plan for TB and HIV medication and delivery and so forth in their hindsight, and they had to concede to that because their focus was on COVID-19. And as a result of that, we've seen a drop of patients collecting their chronic medications. We've seen a drop of patients testing for TB. So all of these things that we used in our healthcare system to function, we have put it on the back burner because now we are focusing on COVID-19, and the impact of that in the long run is detrimental because right now as a country we need to have a balancing act. In order for us to defeat COVID-19, we need to remember that there are other burdens in our healthcare system that we need to take care of.